Alright, so the first thing you want to do when you come in and you're going to assess active range of motion of internal external rotation is I'm going to wash my hands so Carly, my patient, knows that it's a clean environment. And then I'm going to introduce myself, say, "Hi Carly, my name is Zach, I'm going to be your occupational therapist today. And to do the assessments I need to do, I'm going to make physical contact with you." And then first you're going to do a preliminary screen just to make sure that they can do the movements that you're going to be assessing. So first I'm going to say, "Carly, I'm going to have you take your hands and put them behind your head just like this." Good. And then I'm going to have you take your hands and put them behind your back just like this. Alright, and today when we're doing the assessments, if you feel any pain, I want you to stop immediately and let me know because we don't want to be pushing through any pain, okay? Awesome. Alright, and then you're going to have your patient get up on the plinth, and you want their shoulder to be hanging off of the table a little bit. And then that's when you're going to insert the towel here. I'm going to have you scoot over to the side here. And you want the towel's going to go underneath their humerus to prop it up because you want their humerus to be in line with their acromion process. Okay, so once you have your patient up on the plinth, making sure that the towel is underneath their humerus, then you want them to go perpendicular with their arm at 90 degrees. And you're going to have your fulcrum at their olecranon process, the distal arm along their ulna, and then the proximal arm you want to keep that up at 90 degrees. And then your distal arm will follow their arm as they go into their range of motion. And then just instruct your patient, I want you to take the back of your hand, you're doing external rotation first, so I want you to take the back of your hand and move it up towards your head and towards the ground while keeping your elbow fixed in place there. So can you do that for me? Alright, good. And so we have Carly at about 86 degrees there of external rotation, which is within norms. Alright, then again, just to show the movement, we're going to have Carly's arms start off perpendicular to the ground at 90 degrees. So we'll start there. And then we're going to have her bring the back of her hand up towards her head, keeping her elbow in place and towards the ground, keeping that 90-degree angle. And then I'm going to have her bring it back up to perpendicular there at 90 degrees. And the same thing with internal rotation, you're going to tell her to take her palm down towards her feet and towards the floor again, keeping her elbow fixed in this position. And if you could do that for me. And with this one, Carly's got about 65 degrees, again, within norms. And then we're going to have her do internal rotation. You're going to have her bring her palm towards the floor and her feet, keeping that 90-degree angle and her elbow in place. And same thing, the goniometer is going to look like this, and you're going to go along her ulna there and measure it. All right? And then with the norms, for external rotation, we've got 80 to 90 degrees is the norm, and then for internal rotation, 50 to 60 degrees. And then also before you perform your measurements on your client, you want to be aware of any precautions or contraindications that might be stated. The precautions are going to be things that you need to be aware of and be cautious of with your patient, and then contraindications are things that you definitely can't do and want to stay away from no matter what.
So precautions, they vary case by case and are determined more by the diagnosis in the individual. Precautions should be used with painful conditions, when there is inflammation in the joint, if the patient is on muscle relaxants, there's bone fragility or presence of osteoporosis, an extremely hypermobile joint, hemophilia, a hematoma is present, ankylosis is present, soft tissue disruption or damage, and after prolonged immobilization of the joint. For contraindications, they also vary case by case and will be determined by the diagnosis in the doctor's notes. An active range of motion assessment is contraindicated when muscle contraction or motion has the potential to interfere with the healing process or lead to re-injury or deterioration. Specific examples include immediately after injury or surgery where motion will cause further damage or interrupt the healing process, if a subluxation or dislocation or fracture is present or suspected by the therapist, and if myositis ossificans or ectopic ossification is either present in the patient or suspected by the therapist. As for the relevance to occupational therapy, range of motion correlates to the movement necessary to participate in an occupation. Functionality takes precedence over normal limits for degrees of motion, and the range of motion helps therapists set attainable and measurable goals. Steps for shoulder external rotation. Step 1, wash hands or use sanitizer. Step 2, introduce yourself and explain that you'll need to make physical contact in order to complete this assessment. Step 3, ask the patient to place his or her hands behind his or her head or the back of the neck with elbows pointed out. Step 4, have patient lay on back on plinth with shoulder hanging off edge. Step 5, place towel under humerus so that it is level with the acromion process. Step 6, have patient position forearm perpendicular to the ground at 90 degrees. Step 7, place center fulcrum of goniometer over the olecranon process. Step 8, align the proximal arm so that it is perpendicular to the floor. Step 9, align the distal arm with the ulna. Step 10, have patient move arms toward head while maintaining position. And step 11 is typically between 80 to 90 degrees. Steps for shoulder internal or medial rotation. Step 1, wash hands or use sanitizer. Step 2, introduce yourself and explain that you'll need to make physical contact in order to complete this assessment. Step 3, ask the patient to place his or her hands behind their back. Step 4, have patient lay on back on plinth with shoulder hanging off edge. Step 5, place towel under humerus so that it is level with the acromion process. Step 6, have patient position forearm perpendicular to the ground at 90 degrees. Step 7, place center of fulcrum of the goniometer over the olecranon process. Step 8, align the proximal arm so that it is perpendicular to the floor. Step 9, align the distal arm with the ulna. Step 10, have patient move arms toward feet while maintaining position. Step 11, typically between 50 to 60 degrees.